call this April 26, 2022 regular meeting of the Burlington Board of Health to order. Please join me for the Pledge of Allegiance. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I'm Dr. Ed Weiner, Chairman, and with me tonight, our board members, Mary Beth Welch, Andrea Sheehan, Gail Demore, and remote this evening will be our Vice Chair, David McSweeney. Also with us tonight is Susan Luminello, who is Director of Public Health, Michael Green, Associate Director of Public Health, Christine Mathis, Environmental Engineer. Also, we have a new administrative professional this evening, Eric Bergeron, who is our new recording secretary. Please note that we are live on BCAT and available for appropriate comments and questions through this video technology. And thank you to BCAT for what you do for this community, keeping us all aware and so well informed. Thank you, BCAT. Approval of the minutes, March 22nd, 2022.
So moved.
I have a motion to approve the minutes by
Mary Beth.
by Mary Beth.
I'll
Second by Andrea. All in favor? Aye.
Aye.
Actually, I got to call roll call. That's
call,
right.
yeah.
I'm sorry, we're going to call roll call this evening. David McSweeney.
Aye.
Mary Beth Welch.
Aye.
Andrew Sheehan.
Aye.
Gail Demore.
Aye.
And I vote aye. 5-0-0. Okay, which takes us to citizens' time. Is there anyone who is not part of our agenda who would like to speak to the board? Is there anybody online, Susan?
There is someone online, Virginia, but I don't know if she's here for citizen time or...
Ms. Ray, would you like to speak to this board?
Hi, everybody. I'm here actually with Paradigm Properties, Kevin McCall. We are on the docket for tonight.
Yes, you are. Thank you so much.
You bet.
Thank you
Thank
for
you.
identifying yourself. Which takes us to Chairman's report. On April 6th, just a few weeks ago, this board received an unsigned letter from the Department of Health of the Commonwealth of Massachusetts, thanking us for extraordinary service during the COVID-19 pandemic. They even noted the very complex and difficult work that this board and its professional staff faced over the last 2.5 years. Ironic, I and my colleagues on the board have been thanking so many of you who did so much, and most of you in the trenches, to get us through this difficult time. Sorry, Executive Office of Health and Human Service and Department of Public Health, you are again a little late. So, as I do every meeting, on behalf of this Burlington Board of Health, I want to acknowledge our professional staff, Burlington Volunteer Reserve Corps, and those of you of all town departments for your hard work and commitment. And I want to thank you all, and again, I want to thank this board. It's been a long 3 years, and we say thank you. Last, we are always here to discuss any questions that you may have. Our website is a great resource, accessible to everyone, anytime. And most of all, and most important, as you know, we are only a phone call away. So thank you very much. As I say, would any of the board members like to make a comment or have anything to add to that report?
No, at this moment, thank you.
Okay. Which brings us to applications. Application for approval of a special permit, 22 Terry Ave. Is our environmental engineer going to present this, or will they be presenting this?
I can give a quick introduction.
Please.
So the applicant who's with us here tonight is looking to obtain special permits, and you have a list of those in your materials, to convert an existing building located at 22 Terry Ave to be retrofitted for laboratories and life science uses. As such, there's a handful of special permits that would likely be required, including light manufacturing, research and development, labs engaged in life science, hazardous materials use, and the generation of hazardous waste. I will let, right now, there are no tenants identified for the building, and as such, a floor plan and details about the actual building are not, building build-out are not known at this time. With that, I'll let
Ms. Hung,
Attorney Hung?
would you please identify yourself for the,
Yes.
and your colleague also?
Good evening, Mr. Chair, members of the board. For the record, Christine Hung, Reamer and Bronstein. With me tonight, I have Kevin McCall, CEO of Paradigm Capital Advisors. Virginia Ray is also attending remotely, and, they can speak as needed. Just like Christine was saying, Paradigm recently purchased the property at 22 Terry Ave. That was the site of the former Cosman Medical Device and Equipment Supply Company. They had, they had similar uses, and they had a clean room, there was an outside generator pad, but they vacated the building a number of years ago, so it's been vacant. Paradigm purchased it. They would like to redevelop the property to make it a income revenue producing asset. They're not looking to do a lot of exterior modifications, just a couple landscaping, update the landscaping. They don't have a tenant right now. And as Christine said, they're filed some special permit applications for uses, for life science lab type uses. Maybe robotics. Again, in this market, it's the speed to market, having the permit in hand to attract these tenants. So when the permits are obtained, and they're currently marketing the site as well. Really, it's pretty straightforward. Christine had sent to me the proposed conditions, which I've reviewed with the client, and they're in agreement with those conditions, understanding that condition number 3, that prior to renovation or construction of the property, that, when the tenant is known, that we will be back before the Board of Health to introduce the tenant to the town. So with that, I open it up to any questions that the board may have. Thank you.
Do we have any questions?
Mr. Chair, if I may, if nobody in the room does.
Sure, I do, as you know.
As you know,
Yeah.
I always do. That's how they know.
I didn't know if the other board members in the area do, or in the room do. So I guess a couple of questions. Is there a current tenant in the building currently, or is it vacant?
The building is vacant right now and has been for a few years, I believe. So there's no one occupying the building currently.
Great. And is the intent to solely target a biotech company for this building, for this space?
Let me take that. I'm Kevin McCall. I'm the CEO of Paradigm Properties. We're based in Boston. No, there are a number of possible users for this building. As Christine mentioned, robotics firms, the marketplace sometimes refers to this group of companies as intelligent R&D types. So we're not just targeting the life science community. That's only one of a number of possible tenants for the building.
Great. And have you worked or dealt with life science companies in the past, or in other facilities that you own?
Yes, we have. We own some property in Charlestown, crossing the municipal line into Somerville, that has some lab companies in it. We're currently in pre-development process on an 80,000 square foot ground-up purpose-built lab building at that property.
Great, thank you. One last question, and I guess we can talk about this when we make the vote as well. And Mr. Chair, I don't know if there. Again, I can't see the audience. I can't tell if there's any abutters that are there.
No, there
No,
are
there are no.
Yeah. So as you know, and I think as Ms. Hung knows, and probably everyone in the room, I'm a huge proponent of life sciences and biotech coming into the town. This building being right off the center of town makes me just double think or have a second guess or question, particularly as it abuts the residential area. And I know there's buffers there. I know you guys addressed that in material you sent in with vegetation. There's chain link fence. That's pretty secure. I just think that we need to think hard about this, about which tenant comes in. And I also, I don't even know if we can make this a condition, and again, maybe we can do this at the time we vote, but, I would be hesitant in letting a tenant move in that has outside storage of hazardous material. Particularly, like I said, there's a residential
Mr.
area.
McSweeney?
and abutting Yeah,
I'm
I'm
going
going
to
to,
add a proposed conditions to that end.
okay, all right, yeah, that's good. So I just want to voice my concerns over that. Other than that, I'm very much a proponent of these types of projects. I think this is great, particularly as it's a vacant building. This brings jobs and it helps the economy. I just want to be concerned where the building is located, right off the center of town. There's a number of fast food restaurants, yoga studios, and so forth that are there. I just think we need to be cautious, not necessarily carte blanche, blanket approve all of these across the board. So thanks for answering my questions. I appreciate it.
Yeah, I think the restriction on outside storage would be totally fine.
So let me, Mr. McCall, let me add something. Usually when we're approving these buildings, there's a tenant that has already made it known that they're coming. This is a little bit different. Now, I have no problem approving this special permit for biotechnology and life science. But I think we need to add to number 3, and there are a total of 8 conditions. I know that Ms. Hung reviews these inside out, upside down, so she knows. Number 3, I'd like to read number 3. Prior to construction or renovation, the applicant/property owner must appear at a Board of Health meeting to provide details regarding treatment, management of wastewater, chemical hazardous waste, storage management, outdoor storage of chemicals, and site security measures. If applicable, the applicant property owner must adhere to the town Burlington Control of Toxic and Hazardous Materials Bylaw, which is Article 14, Section 2.4, and prior to operation to submit a hazardous material registration form, HMRF. Basically, we're saying, once you have a tenant, we need you to come back.
Sure.
Because I'm sure that if it's a biotechnology laboratory, you're going to have CO2, carbon dioxide tanks. You may have a nitrogen tank. You may have hazardous material storage, and I could go on and on and on. Maybe a generator also. So I have no problem, as I think we heard from Mr. McSweeney, approving this. I think we need to, once you have a tenant, come back here, because I don't want you to start building and then come back here and say, no, you can't do that. No, you can't do that. Because as you know, you are pretty close to the residential area.
Mr. Chairman, just to be clear, the other board members don't have the
Yeah, because I'm
change
reading,
to
I'm looking at,
number
yeah, thank
3.
you, Susan,
So
that
if you
was my
want to
question, thank you.
clarify what you want to change in number 3.
We want to change the first two actually, it's the first sentence.
Prior to occupancy.
Yeah, it's a run-on sentence, teacher. It's a run, but it says prior to construction / renovation, the applicant/property owner must appear at a Board of Health meeting to provide details, and then it goes on. And that's where I am right now. I have no other issues with this as chairman.
I was just going to clarify that.
Okay.
I was just going to clarify that the major change is that what you saw said prior to operation. We're saying prior to doing any building modifications, you have to come back once you have a tenant and provide us details about where stuff's going.
Okay.
The condition that they're looking at says that they have to come to the Board of Health staff, so the change is mainly that instead of coming to the staff, they're gonna be coming here to the board prior to
Yeah, the
occupancy.
only concern or caveat I would have to that is if they're not leasing or renting to a health science company, right? I don't know if we necessarily need that in there. So, and I don't want to tie their hands as well. So I don't know if we can look at the wording specifically around biotech companies or hazardous material storage or something.
Well, it could be.
It could be any of the science companies that have hazardous materials that we saw with an issue 2 weeks ago. So I just soon leave it that.
Yeah, that's fine. Well, no, I'm just saying if they lease it out to
Exactly.
Macy's department store, they don't need to come in front of us before they start building out the.
Well, we can
Well, we can
decide
decide
that
that
at
at
the
the
time.
time.
Yeah.
But they're asking for a special permit.
here for biotechnology lab
Right.
and life science.
I
Is
get
that
that.
just to make it more marketable, or?
No, that's to allow that to go on.
Well, it is. They're trying to
Well,
get the
they're doing it
permit.
Before they
Correct.
even identify a renter, so it's,
Season elsewhere, it's a property too.
okay.
I think when we did this condition, one of the main concerns was looking at the responsibilities of the property owner, because sometimes in these biotech companies, they might have more than one biotech company in a building, and then the property owner is now responsible for the wastewater operations and things like that, or one main hazardous material storage location. So if any of those things were occurring with regards to the responsibilities of the property owner, we wanted to have them come back and make sure we knew what they were.
Noting that any most biotech companies would also have to come back to the board for a biological safety permit.
Correct, anyway, but that can come even later,
Exactly,
but we don't want to hold them up.
right.
I don't want to hold you up because we're just asking for a special permit for biotechnology and life science.
Getting back in front of the board early would actually be our intent.
Yep, good. Any other?
And I think the only thing we mentioned is that we're removing the outdoor storage of chemicals. Wasn't that
That, as the chairman said, if your tenants are gonna be life science, it's highly likely that you might have an outdoor CO2 tank or an outdoor liquid nitrogen tank. And to prevent that would probably hinder your operations.
And you also have to consider backup generators, which is also,
Which I mentioned.
Outdoor storage,
Yeah, and I guess maybe can you just exclude certain classes, or you know what I'm saying? That makes sense, right? But I don't want some really hazardous chemical being stored outside.
Yeah, well, that's why they'd have to follow our bylaw anyway. They'd have to be in compliance with our bylaw.
correct.
Is that okay, Mr. McSweeney?
Yeah, but I think doesn't our bylaw allow for outside storage of?
Yes, it does.
as long as it's like, it has to be
Secure.
roofed and secured, and there is some, mainly it's, with these types of companies, it's like you was talking about,
With liquid nitrogen.
compressed air or a liquid nitrogen tank. I don't think we have any other types of outdoor storage other than that.
No, I mean, there
Other
might
than
be a
diesel.
loose
I thought we had, I thought we did.
fuel oil out there, but that's it.
Liquid nitrogen?
No, I'm saying, other than liquid nitrogen or
Okay.
CO2.
Okay.
Or diesel for a backup generator. As Attorney Hung mentioned, there's currently a pad there for a backup generator. Most life science applications will require backup power, just by the nature of their operation. So, but beyond those, it would be atypical for anybody to have outdoor storage. And you could have that discussion when the landlord comes back to say, that's beyond the typical request for outdoor storage.
Yeah, our experience is that most of the lab users, the overwhelming majority of the lab users that handle chemicals, which are most of them, handle them, store them inside the building in code-appropriate ways. So with the exception of an emergency generator or liquid nitrogen tank, there really is not, in our experience, any need for outside storage.
Okay. Your attorney will lead you in the right direction. She's been here doing this for a long time. Okay, so I'm looking for a motion. I have
Mr.
a,
Chairman, I will make a motion to approve the application for special permit 22 Terry Ave with the recommended changes to condition, I think it was 3.
okay,
Okay,
I have a motion, by Mr. McSweeney. Do a second by?
I'll second the motion.
Second by Andrea Sheehan. All in favor?
Do
sorry?
the roll call.
I'm sorry?
You're gonna do roll call.
I'm gonna do roll call.
Okay.
All in favor? Mr. McSweeney?
Aye.
Mary Beth Welch?
Aye.
Andrea Sheehan?
Aye.
Gail Demore?
Aye.
And I vote aye, 5-0-0. Thank you for
Thank
coming.
you very much.
Thank you very much.
Thank you.
Thank you for your time and
Welcome to Burlington. Do you have any other
You guys sign in?
facilities here? Mr. McCall, do you have any other facilities in Burlington?
We don't currently.
Well, welcome to Burlington.
Happy to be back to Burlington.
Thank you.
Thank you all.
And I just want to note, Mr. Bergeron, I know things are coming fast and furious. So you'll get used to it. We'll get you going, so don't worry. All right. Next is discussion. Massachusetts Mosquito Control Task Force recommendations for mosquito control reform presented by our director, Susan Luminello. I just want to point out to the community that she put together a beautiful summary, but I'm sure most of you looked at the 300 and...
It was 403.
I printed it by accident.
300, oh my gosh, 373 pages. 323 as the report and 50 for the proposal. So yes, I did read them all and you printed them all.
I looked at.
I'm only on
most of it.
page 200, but I'm getting there.
I
I
went
highlighted
to
some
403.
stuff.
I got 403.
Okay, so,
So this presentation is prepared to, just to give the board a background of where the state is at right now with regards to mosquito control. There currently are no changes that are happening, it's just being discussed, and there's no actions that the board has to take at this time. It's just mainly to be informative, keep the board up to date, so that it's not something new when changes do happen. So, I'm going to give a background of mosquito-borne disease in Massachusetts and how it's regulated, how the mosquito control is regulated. The two most concerning mosquito-borne diseases in Massachusetts are West Nile virus and Eastern equine encephalitis. The symptoms of West Nile virus can range from a fever to encephalitis or meningitis, though most infections are mild, with approximately 80% of cases being asymptomatic and less than 1% resulting in serious symptoms. Human cases vary from year to year. The peak of 48 cases happened in 2018. The Northeast Central Massachusetts, Suffolk County, East Middlesex, Norfolk County, Plymouth County, and Bristol County have the greatest number of positive West Nile virus tests in mosquitoes. Eastern equine encephalitis more often presents with serious disease, with approximately a 30 to 50% mortality rate and a lifelong neurological disability among many survivors. It follows an outbreak cycle with several years of no or very low activity, followed by 2 to 3 years with multiple reported cases. So the peak number of EEE cases reported in a single year was 12 cases in 2019. Plymouth County and Bristol County have the largest EEE mosquito habitat and the greatest number of positive tests, EEE tests in mosquitoes. As you can see, symptomatic human cases are rare for both EEE and West Nile virus infection. Between 2000 and 2020, only 3 years had more than 20 reported cases of either disease. However, in the past 2 decades, 2000 to 2020, there have been sporadic outbreaks of both diseases. The difference in incidence between West Nile virus and EEE is likely much larger because the higher frequency of asymptomatic West Nile virus infections results in the underreporting of cases because it's very mild. There is greater concern for EEE because of the disease's severity and high rate of morbidity and mortality. These 2 tables show the incidence of human cases of EEE compared to the number of deaths over time, and the incidence of human cases of EEE by county from 2000 to 2020. As you can see, Plymouth County has the highest number of EEE human cases with 15 cases over 20 years, and Middlesex County had four cases over that 20-year span. Mosquito control is governed by Chapter 252 of Mass General Laws, which was first enacted in 1918. Because the legislation is out of date, there is lack of clear guidance for mosquito management. Actions which are no longer considered best practices, such as draining wetlands, and no consistency across the state with decision-making, funding structure, and services offered. Currently, there are 3 key entities with authority to conduct or support mosquito control. The first is the State Reclamation and Mosquito Control Board, which is a 3-member body composed of representatives from the Mass Department of Agriculture, DEP, and the Department of Conservation and Recreation, or DCR. They oversee mosquito control activities and can perform mosquito control operations, including spraying. They certify budgets for mosquito control at the regional level and establish administrative and technical policy to ensure safety and efficacy of mosquito control programs. In the event of a termination of a public health hazard, the board conducts aerial spraying operations. So that's, in a year when there would be really high EEE cases, like mainly in southern Mass, they were the ones to decide to do aerial spraying for EEE. The Department of Public Health conducts surveillance and testing of mosquitoes and monitors trends in eastern equine encephalitis and West Nile virus. They work with the State Reclamation Board to achieve consensus on whether aerial application is warranted. There are 11 regional mosquito control districts. They serve as the primary organizations responsible for mosquito control activities, and those are monitoring and surveillance, public education, and pesticide use if necessary. And they do this on lands within their participating municipalities. Burlington is part of the East Middlesex Mosquito Control District and pays yearly fees out of the Board of Health budget for helicopter larvicide spraying, larvicide applications to catch basins, mosquito surveillance, and truck-mounted spraying for mosquitoes. And that's truck-mounted spraying is based on the surveillance activity that they do. On July 20th, 2020, an act to mitigate arbovirus in the Commonwealth was signed by the governor. The act created the Mosquito Control for the 21st Century Task Force. This task force was charged with commissioning a study to complete a comprehensive evaluation of the mosquito control process. Eastern Research Group, which is a consulting group, developed 9 reports addressing topic areas requested by the task force. From those reports, the task force voted on recommendations to either amend Chapter 252 or create new legislation on mosquito control. So I'm going to get into a little bit about what the task force recommendations were after those 9 reports that were done by ERG. So the key recommendation of the Mosquito Control Task Force, the first was to restructure the Oversight Board. They wanted to include more state agency representatives to create additional subcommittees and provide oversight of the mosquito control districts. They recommended amending the funding structure. They want to provide funding to all municipalities for surveillance and education, allow municipalities to opt into additional services such as larviciding and adulticiding, funding for pilot studies to further investigate concerns about novel exposures, and that would be emerging contaminants. That would be such as the PFAS. Another recommendation is to amend the Massachusetts Stormwater Handbook. They want to use more low-impact development techniques designed for minimal maintenance, ensure no standing water within 3 days, and treat those areas. They want to create guidance on integrated pest management, or IPM, which is a strategy of pest control to reduce the need for reliance on chemical pesticides. Strategies include monitoring, determines to see if there is a need for chemicals, limiting standing water, using natural pest enemies, and judicious use of the lowest risk pesticides. They want to limit ground-based application of adulticides, which is the truck-mounted spraying. Conduct truck-mounted spraying only when alternative methods such as source reduction, water management, and larviciding are not feasible or not effective. Clear thresholds for spraying should be defined, and surveillance data should demonstrate elevated risk. Thresholds may need to be tailored to such factors as season, weather conditions, mosquito species in abundance, and the density of nearby residences. They want to increase the statewide mosquito surveillance and education. They want to improve chemical control. And some ways that they suggested to do that would be test chemicals that are used for quality control, research the impacts of pesticide runoff, design ecological monitoring program to reveal potential impacts, fund research on potential impacts, create a subcommittee of the board to further review all of the pesticide products, conduct analysis on pesticides to ensure there are no emerging contaminants present, which they called out specifically PFAS. They want to increase transparency in reporting, so suggestions on how to do that. Have an online reporting for commercial applicators, enhance communication with public water supply systems, have an online system for requesting and tracking property exclusions and opt-outs, which everybody can do now, but they want to have one main online way to do that. Improve public outreach and input, provide funding for independent organizations to conduct research to evaluate mosquito control, and share map files of each pesticide application. So those were all the recommendations set forth by this 21st century task force. So what happens next? This task force was created pursuant to Chapter 120 of the Acts of 2020, and it concluded its work on March 31st, 2022, and it filed its recommendations with the legislature. The legislature has no required actions or deadlines for reviewing or acting on the recommendations of the task force, and according to the Mosquito Control District, it's unlikely that the legislature will act on the recommendations during this legislative session. So the East Middlesex Mosquito Control is going to continue its work as it always has done until such time that the legislation acts and makes any changes, which would be either amending the current law, which is very old and outdated, or getting rid of it altogether and creating a whole new one. Any questions?
Questions?
I do. Susan, you said that there's a surveillance activity. Is there a schedule for that? They do that surveillance activity?
So there's 4 locations around town where they set out the traps. They have a schedule, I believe, for going and checking the traps. And they try to keep it consistent, so that they're doing it the same periods of time. So they go out and they check the traps, and basically what they do is count how many mosquitoes in the traps in every area of town. They take some samples and test some of those mosquitoes for West Nile virus and Triple E. If they get a hit of mosquitoes for that, they let us know. And then if they have a higher than normal incidence of mosquitoes in the trap, then they will decide to do the truck-mounted spraying. And I think what the task force is looking for is probably more surveillance than what they're currently doing to kind of make it more widespread the surveillance activities.
Is that gonna be including, like, putting out more traps to collect more?
Well, they don't say specifically how they're gonna do it, they just, one of their recommendations is to increase surveillance in all areas before deciding to do the truck-mounted spraying. So instead of just saying, oh, we have more mosquitoes over here, let's truck-mount spray all these neighborhoods, to do it, to do more surveillance before deciding to do that.
In our truck-mounted spraying for Burlington, do we do additional ones if we get, the surveillance requires us, right?
Right.
Okay,
Right.
that's what I thought, okay. Any of what the task force has put together, did they build any of their data from other areas that are already implemented?
Like other states?
Other states, yeah.
I didn't see anything about other
I
states.
think so, I didn't know.
The
Hey.
ERG initial report, it had a summary of the northeast states and their activities.
Yes, they did that all
Looked
of
like
this.
they looked at Connecticut,
Can they look at
Okay.
a number
New
of different?
Jersey.
They looked at,
Vermont.
yeah, it was New England and New Jersey and New York, I believe.
You know, I think this is good for a couple of reasons. First, we need to understand, and I'll get to why, the impact on people, what are these really materials? You know, I would have not guessed there's that much PFAS, but there is, and it may be for the containers rather than the actual pyrethrins that they actually use. But they've got to look into that. Here we are doing everything we can to cut the amount of PFAS in the community, and they're spraying it all over the place. So we have to understand the impact on the environment, not only for risk for people who are in this, who live in this environment, also, the pollinators. And pollinators are so important for this country, for the world, and they do have, the chemicals do have an effect on bees, and I've heard anecdotally from people who own apiaries, that they have been wiped out. In Burlington is a very difficult place to keep bees in Burlington. And the last is, what they allude to and they don't get into is they want to do something with the independent applicators. As you know, every time I turn around, there's another company that wants to spray your backyard and spray. And I have no problem with that, except if there happens to be a beekeeper across the street or next door, and they're talking about at least setting some database up, so before they spray, they may know about it. So there's a lot here, and most important is they are very clear about the local Board of Health Authority. And right now, under the old regulations, we have a lot of local authority. And we know some of our local communities don't allow mosquito control, some do. But I think that we need to keep an eye on what they're proposing for local authority. So there's a lot here, and the only other suggestion is clearly personal, and that is, if we're gonna discuss this and get involved in this, we need to print out all of the documents. I know it's 400 plus pages, but it's difficult to read online, especially. So, thank you. I don't think there's any actions for us to do, except keep an eye on what's
Mr.
going on.
Chairman, just one comment if I may. Susan, you can tell you spent a lot of time on this, and I really appreciate the education around this. The board's been responsible for mosquito control for 50 years, or probably since the inception. Don't know what the day was, and I don't think anybody realizes what goes into this and or the research. So I really appreciate the information you shared, and I know the community probably does as well. But thanks for bringing this forward, and I agree with the chairman. There's not much to do here, but wait and see. But it would be something that we definitely need to address once they come back with the recommendation. So thank you.
Thank you.
And we appreciate the buzz. Do you want us to approve this formally, or is this just a report?
No, it's just informational, yeah.
Any other questions before we move on?
Okay.
Okay. Thank you very much, it's really good. Staff reports, environmental engineer.
Good evening. Just a point on your comment about beekeeping. I did attend a number of the listening sessions for the Mosquito Control Task Force, and the beekeepers were very active in reviewing and commenting on this content. So if there's any questions from the board on my report.
I have one. Just to keep a new Board of Health
member up to date, could you just describe what our universal waste pickup is? So,
Oh, sure.
So, and also people watching.
Sure. So every year, twice a year, as you all know, we do a household hazardous waste collection day. And at that event, we accept mercury-containing products, which for the most part are light bulbs and maybe some old thermostats or switches or stuff like that from appliances. And that gets collected by our the folks at DPW who help us out greatly on that day, and they do consolidation of all that material. And then the next business day after household hazardous waste, that material gets picked up here by our vendor. That is all managed under a grant. Well, I guess, is it a grant, Susan? Or is it the universal waste? We don't pay for the disposal. It's funded by a grant that was given to Covanta disposal company.
Thank you.
Yep, thank you. Sure.
If there's no other questions, can I please have a motion to approve the environmental engineer's report?
So moved.
I have a motion by, there's Mary Beth Welch, is that right? Yes. Second by? Second by Gail Demore. If any other questions, if not, all in favor? Mr. McSweeney? Aye. Ms. Welch?
Aye.
Andrew Sheehan?
Aye.
Gail Demore?
Aye.
And I vote aye, 5-0-0. Brings us to the Associate Director of Public Health. Michael, do you want to highlight anything?
I'd like to highlight my inspection I did with Marlene Johnson in regards to the voluntary National Retail Food Program standards. We are going through Standard 4, and we're doing our self-assessment audit now, and that inspection definitely highlighted the quality of the program we have. I've got to do 11 more between her and Sam Hardy, but it's definitely off on the right foot.
Any other questions?
I do have a question, because I was looking at, I think at partly of Marlene's report, it had said that for the standard of 4 self-assessment. Can you just give a little bit more detail on the self-assessment?
Yeah, so in this audit, we basically want to make sure that we're doing a uniform risk-based inspection. So instead of highlighting the smaller items that you typically run into during a food inspection, like maybe dirty floors, greasy walls next to the fryer, stuff like that, we're focusing more on the 5 determinants that could really affect public health adversely. So really focusing on employee health and making sure they're washing hands, hand washing facilities set up, proper cooking temperatures, hot and cold holding temperatures, proper cooling techniques, and making sure temperatures are right in there, and then clean food contact surfaces. So more of the directly related health effects or things that affect health. So I shadow that inspection, so I'm not involved in the inspection in any way, but they do have a form that I fill out, and I went through this in my past position in Minnetonka, so very familiar with how the process goes, and that's really what we're focused on, make sure we're hitting those risk-based and that we're uniform with our inspections between our inspectors.
Thank you. I just think if someone is looking at the report, you explained it. Thanks so much. Appreciate that.
Any other questions?
I was just wondering, on the cybersecurity training, now that you've attended that, is that for just internal use for the town? Or is the town going to then do some type of awareness to the general population?
This, I believe, is statewide cybersecurity training that we opt into, so we get kind of a reminder every once in a while to conduct a different aspect of cybersecurity training. I've been here, I think, 5 months now, and I've already done it twice, so, but it's a really good refresher on, the one I went over was, like the Trojan horse and the social engineering, where they try to impersonate someone else in the organization and get information from you. So being a statewide program, I think we all kind of get these assignments thrown on every once in a while. I just have to stay up on it.
Every single professional person within within the town has to take this if they're going to have a town email. And they're not giving away town emails anymore, are they?
No, and it's mainly to protect the town, so that somebody doesn't click on the wrong thing.
Yeah, no, it's just such a big problem. People really underestimate how bad the fraud world is.
Yeah.
And I just think that if we could do something for the community, similar to the other things that we do as a volunteer basis, the education alone may help other, members of the community. So that's why I wondered if there was any follow-up to that training that the town does towards the general population. Okay.
Okay. Are there any other questions? If not, do I have a motion to approve the Associate Director of Public Health?
So moved.
Motion
Second.
by Mary Beth Welch, second by Andrea Sheehan. No other questions? All in favor? David McSweeney.
Aye.
Ms. Welch.
Aye.
Ms. Sheehan.
Aye.
Ms. Demore.
Aye.
And I vote aye, 5-0-0. Which takes us to the Director of Public Health. Now, the Director of Public Health's report is made up of the Supervisory Nurse from Christine Pollock, the Health Agent was Marlene Johnson, the Associate Health Inspector, Samantha Hardy, and then the Director's report. You have all of them. Let's go first to the Supervisory Nurse. Does anybody have any questions? Can we make an announcement also about the Supervisory Nurse? The Supervisory Nurse, with a heavy heart, I have to tell you that she has resigned her position, and she will be leaving in about
Not until September,
September,
so she's
6
staying
months.
for, yeah.
She's, Christine Pollock has done such a beautiful job, and she's moving away. So, if does anyone have any questions about her,
I think I have one question,
Sure.
and I'll echo what you said. She has done an amazing job. She's going to be missed. Susan, on her report, there was a health fair, skin safety testing. Is that an activity for the health fair?
She's been working on trying to get different types of vendors to, come to the health fair. So I think that may be one of the places that she reached out to in the hopes that they would be able to come.
I think I asked a lot of those questions about the health fair at each meeting. There's just so much more each year added, and it grows. And I'm not that I'm promoting it, but there's just like a lot of opportunity.
please promote it.
Well, there's a lot of opportunity because there's a lot of new and additional activities or vendors. So I think it's great.
And the collaboration this year we're collaborating with the rec department.
Yep.
So they're doing an adult fitness crawl and a kids fitness crawl that's gonna be going on at the same time on the lawns when we're having the health fair going on, so. And we have about 50 vendors now, 50 tables that are gonna be set up on town common. So Mike and Chris have been doing a great job in trying to pull people in and get more vendors for it, so that's good.
So for those people who are watching, what's the date?
May 21st, do I get that right? Yep.
Any hours?
10 to 1,
So what, you got it right, and please, I hope everyone comes.
And your rain date?
the next
The
day.
next day, the
Great.
22nd.
Okay, great. Thank you.
The other comment I have is, She did put in some surveillance for ILI, which is the influenza-like illness, which is the flu. And most of us are not wearing masks anymore, and the flu is coming back, so be careful. No other questions? We'll go on to the next, which is the health agent, Marlene Johnson. Does anyone have any questions about her report? She will be going to Connecticut soon.
Yes, her and Samantha are going next week. They're leaving Monday night. They'll be there all day Tuesday, working with their mentor, and then they'll be coming back on Wednesday.
This is part of the grant that we received
Yes.
from the federal government. Okay. Is there any other questions on hers? Okay, we'll go on to the next one, which is the Associate Health Inspector, Samantha Hardy. Just, I never realized, or I did realize, I say this every year, how many camps we have in this town. And Samantha is the person who inspects those camps and
Yeah.
looks at all the documentation. We have a lot of camps in Burlington.
And not only that, there's a lot in the regulations. They're very detailed, so there's a lot to check on top of that, so.
One question, or I guess comment, on this is, I see, Lord Barron is on here multiple times again. And they have consistently been over the last several months, with tenant issues. Is there a way or an opportunity potentially to have a broader conversation with Lord Barron management themselves? It just seems like we're dealing with the one-off situation. We're being, diligent in that. We're doing a fine job with it, but it just seems like they're consistently in violation, one way or another consistently in our board deck, and wondering if there's something we can proactively do to help mitigate that.
I'll leave that to you.
I mean, every time we have a complaint, we reach out to them and discuss it with them, what needs to be done. I think you're probably seeing it on Sam's report, because it may have been the same one that has continued over, because sometimes they take a little bit longer to resolve. So if she's, has two reports 2 weeks apart, some of these violations, they go 30 days, and that may be why you seem like you're seeing it more. But when I think about how many complaints we've had over there in the last, say, 2 months, I don't think it was more than 2 or 3. So 3 probably at the most. I mean, I have to go back and look at that. Not to say that that's not, we would like to have none, but.
Yeah, I think, we have other apartment buildings in town that don't have any and haven't ever been, written up or so. And again, these particular ones look different than the issue that came up at last board meeting. Again, I'm not trying to nitpick. I just think if there's an opportunity to be proactive, it's just not fair that they wait till they get a complaint, whereas they know that they have some ongoing issues that they should be proactively addressing. And I would like to see us, better be proactive for our community than waiting for a complaint to happen.
We could certainly invite them to come to a board meeting if that's what the board so chooses to.
Maybe that's the answer, or maybe it's a work
The
session
only
with
issue
them or
is-
something. Yeah.
We're not going to
Solve any individual problems here unless,
Right.
and I think maybe we should talk
Maybe
to them.
a meeting with them, a subcommittee meeting, or whatever, just a roundtable discussion. Like it's, one, it's a waste of time. One, it's impactful. These are people's homes, and like I said, there's other large apartment complexes in the town that don't have any issues.
Mhm.
I mean, if you'd like to do a subcommittee, I could,
We could talk to them sometime.
okay.
Okay.
Maybe
you could
involve the health agent who spends a lot of time there on occasion,
So
and
the-
set something up.
Samantha, yeah.
Either Samantha or Marlene,
Marlene doesn't do housing.
so be Samantha.
It's usually either Samantha or myself.
Okay, maybe you two talk, and maybe we come up with a day.
Yeah.
And then maybe Wednesday evening, so
Yeah.
we, more of this is
Okay.
very good.
Thank you, I appreciate it.
Which brings us to the Director of Public Health. I have two questions, but please, do you have any questions of Susan Winnella's report? No? Susan, I have a couple. First, the PFAS pilot study. That is the study that the DPW is using to test the effectiveness of the process of removing PFAS. Is that correct?
Right, so I attended the Northeast Conference on the science of PFAS. It was a 2-day conference. I learned a lot at that, mainly that, there's still a lot that needs to be researched and looked into. But one of the sessions that I had attended was on water treatment. So I had some questions for John regarding the pilot study, which is going on now. And mainly my questions were revolved around what was gonna be used. I know activated carbon was one of the methods that they were gonna use, but I was wondering if they were also going to use an ion exchange type of system, as well as what type of testing they did for PFAS chemicals. Not just did they test for the PFAS 6, but what did they test for? They John said they ended up testing for the PFAS chemicals, which are part of the UCMR, which is the EPA's standard for emerging contaminants. And so I had a lot of interest in that, and at the end of the pilot study, they're gonna do a report. So I asked John to share that report with me so that we can be knowledgeable at the Board of Health regarding, what's going on with the pilot study, what they're going to be doing. Because with PFAS, the PFAS contaminants they test for is only 6 of them. There are 10,000 PFAS chemicals. So, what happens 10 years from now, 5 years from now, when there's a new PFAS that they're now testing for? How do they retrofit the plant to take out new and different PFAS chemicals? So I wanted to kind of get some information on that. And what he did say was they were going to use or potentially have the plant set up to use both types of treatment methods, not only the carbon, but also the ion exchange after that. So even though, we might have carbon first, and it's all gonna depend on what comes out during the pilot study, so that's why I wanna see the report. But they have the carbon first, there's still the room and the capability to add on to it if additional treatment is needed. So that's what that conversation was about.
Maybe when it's done, this is the site where we have had the hearings on PFAS, and I thought that was very constructive. Maybe when he's done, we can again hold a PFAS hearing, because I hear I get a lot of questions about PFAS in the community.
Yeah, to learn about what came out of that pilot study. Yeah.
And then the other question I had, I think it's important, you just quickly review Article 40 and the warrant, that the changes that were made in the original warrant from the change in the warrant right now. So I think it's important that you just mention it.
So there was an original article, this is what I think I mentioned at the last meeting about the 2 feet of separation between the foundations and the groundwater. And in the original article, one portion of it had different town departments, including the Board of Health, reviewing the engineer's reports on whether or not it met that 2 feet of separation. So I asked planning to take that out because I didn't feel that that's something that is a Board of Health, that the Board of Health should or can actually be working on. And if somehow it got missed and it ended up in the warrant, and then we had to go through trying to make sure it got taken out after that meeting. So it's all set now. it's taken out, and the Board of Health is not gonna be put into this particular warrant article as far as having to look at those plans.
Good. Any other questions?
I just had a quick question about your social media plan, because I know that we had talked about it, but also I started thinking about a few things that came up while I was campaigning, actually, and it's specific to the senior spotlight. Have we ever had a partnership or published things that we're doing in the senior spotlight?
Yes.
'Cause what I found, okay, because what I found was the seniors seem to state that they're not on social media, and everything's tending to go that way, even newspapers.
Yeah.
And they want to know more.
Yeah, so when we have events coming up, Marge, the COA director, does the senior spotlight. So we try to, if we have something coming up, we try to reach out to her. I believe we reached out to her about the health fair and any events that we have coming up, we try to let her know so she can put it in there in the senior spotlight. So she does it, but we ask her to put stuff in.
So when like
Have
random
events coming
things
up.
come in, such as like the PFAS study, could we give us?
I don't know if Marge is, yeah, I mean, that's up to Marge. I don't know if she would want to get that detailed
That was
with
a
the,
hot topic
yeah,
amongst the seniors.
the PFAS.
Yes, and how bad the water is, and they don't know what's going on. So
If
I
we were
just-
gonna have a discussion here, that might be, like, if we were gonna have some kind of,
Well, we had
Open
one,
discussion, we
open
could-
forum. We could have one during the day. We could have one with the seniors once we have the results.
yeah, that's a good idea,
Okay,
yeah.
just to kind of appease their fears, because they're hearing things, but I'm not sure it's actual factual information, you know, because it
Yeah.
could be part of rumor mill a little bit. Oh, my daughter told me this, and is it really true?
Yeah,
You know?
and I think when it was first going on, I mean, there was John Sanchez had done things on BCAT and stuff like that, so I think they were trying to get the information
To
out.
me, some of them said they don't have BCAT.
Oh.
Because I kept saying, well, there's a ton of information out there, there's this and that, and, you know, I mean, I'm just thinking of different angles.
Yeah, so, I mean, if we did a type of forum, we could certainly invite, John Sanchez to that, because, I mean, he's overseeing the whole thing, I just was
Okay.
asking him to share, you know, so, yeah.
I invited our universal waste vendor to, it was a while ago, to come in, and they did a presentation in the senior center on exactly what we take at HHW and, or how to drop it off here for the few items we can take here. So I did that in the past.
Oh, that's good, thank you.
And we would have to do PFAS with Department of with John Sanchez,
Yeah.
Department of Public Works, because we're not responsible for the water in town. We're responsible for the health of the community, but not the water. So, and John Sanchez has been outstanding in coming in and doing that, and we could do that. That's a good suggestion.
I just don't want the seniors to get lost with all the technology.
Yep, that's a good idea. Nothing else? Do I have a motion to approve the Director of Public Health's report?
So moved.
I have a motion by Mary Beth, second by Andrea Sheehan. All in favor? David McSweeney.
Aye.
Mary Beth Welch.
Aye.
Andrea Sheehan.
Aye.
Gail Demore.
Aye.
And I vote aye, 5-0-0. And with that, do I have a motion to adjourn? Maybe before motion to adjourn is please, everybody be well, everybody be safe. Whether you'd like to wear a mask or not, it's your decision. You may want to, as the numbers seem to have increased in certain situations. And as always, if you have any questions about COVID-19 or any questions about anything concerning the public health in this community, please call, or if the seniors, please come upstairs. Take the elevator up, and there are so many people here who'll be happy to speak with you. And with that, do I have a motion to adjourn?
So moved.
Second, motion by Mary Beth Welch, second by
Second.
Gail Demore. All in favor? Mr. McSweeney.
Aye.
Mary Beth Welch.
Aye.
Andrew Sheehan.
Aye.
Gail Demore.
Aye.
And I vote aye, 5-0-0. Good night, everybody. Be well, be safe.
Good night.
Thanks, folks.
Good night.